think that question you just asked may shed light on this big mystery that I've been dealing with. It has to do with exactly what you just said in terms of ability to form what's called a capitated contract, where the doctors in the hospital are paid a lump sum basically in advance, and then any money that they save at the end of the treatment period, it goes back to them. So it's like an HMO where it incentivizes everyone to provide less care. So it's like a form of rationing, and it's been tried many times through HMOs, and there are obviously lots of problems with it. But I want you to hold that question, because I'm looking into that right now, and I think there'll be some information to follow.
Sure, go ahead.
I just wondered, do you happen to have any idea what the effect of so-called Obamacare was?
Well, we're going to have to spend a lot of time doing that, and that's a whole meeting in and of itself. And
If the Tea Party will have me back, I'll be more than happy to give a 3-hour presentation.
yes, go ahead.
You said there are 26 doctors on the staff. How do you know that this was good?
Well, as Dr. Duncan already said, we took a unanimous vote at our last medical staff meeting to have the Board of Trustees rescind their vote to regionalize. So, and you have to remember, we now have essentially 3 different groups of doctors in town. We have people in private practice, like Dr. Duncan, myself, and Dr. Caldwell. You have another group of doctors that are employees of Sutter Hospital in what's called a foundation model for primary care. They can hire obstetricians, pediatricians, and family practitioners and internists. There is another foundation that can hire specialists, and the 2 general surgeons we have in town are now hired by those entities. There is something that my organization, CMA, is very adamant about, is preserving the corporate bar. The corporate bar that exists in California, one of the few states that continue to have that, it's something that does not allow hospitals to hire physicians. And the reason we don't want them to do it is exactly the reason we are here tonight. Because we don't want the hospital to control us and medical decisions that are made. There's something called economic credentialing, and I don't want to get into a lot of these specific terms, but there are things that if somebody's paying your check, they may have ways of having you practice a certain way, order certain tests, do certain things a certain way. That's not a guarantee, but that's a possibility. And economic credentialing is something that my organization, the California Medical Association, is entirely against. We don't think it's good medicine. We don't think it's good for doctors, and we definitely do not think it's good for you as patients.
And that's another superb question. I'm just amazed, I'm not amazed, I guess I shouldn't be, about how in tune this audience is. You know how the world works, and when your CEO is sitting next to you and there's a vote coming up, it's very difficult to go against the CEO. I'm not going to tell any of the audience how specific physicians voted, but you're certainly welcome to ask any doctor their opinion on this issue. I guarantee they all have an opinion.
Yes, right, straight in the back.
First of all, this is my first tea party. Thank you. And I share Dr. Duncan's fear of talking in front of people. So, you said you need everybody to write a letter. I'll write a letter. But to be honest with you, I think everybody in Delaware County could write a letter, and I think that these guys' minds are already made up. I don't think they care what we do. You talk about talking to our supervisors, but I haven't heard anybody mention our congressmen or senators. I mean, we need somebody with big huevos to...
That's a good idea also. There is one example. When the Sutter affiliated hospital in Sonoma County was attempted to be regionalized, they went for their board of supervisors, and the board of supervisors said, we're not going to allow this to happen unless you give us 6 seats on this board. Now, we have been told that that's an impossibility. We've only found this since Dr. Duncan and his wife, Dr. Duncan, have been doing all this research and found that, sure enough, they did guarantee other hospitals seats on this board, whereas we've been told, no way are you gonna be guaranteed a seat on this new regional board? And again, that regional board, you have to remember, is not like our board here. That regional board can be dissolved by what's called the general member. The general member is defined by Sutter Health as Sutter Health. So their CEO can say, we don't like what you guys are saying, you're out. 32 other members are gonna come in, we're gonna, and these are not elected people. These are people that are appointed. So they can appoint whoever they want. But your point is well taken. I think there are many things going on with this issue right now. And what's gonna happen, I can't tell you, but I can tell you, I think if we have a groundswell from the public, they've already heard this from us. They've heard it from Kevin for 2 years. They've heard it from Greg for this last 6 months. And I know as chief of staff in 2004, I can't imagine what these guys are going through. Those things are hell. And, you know, I think we owe it to ourselves and our community to make the best effort we can. And we need to write letters. We need to contact everybody else we can. And in the final analysis, I do think, remember, you are a customer of the Sutter Coast Hospital. If you decide that you want to go someplace else, you sure can. And I think sooner or later, they're going to have to realize that, and I think they're in the court of public opinion, that's where we're hoping that we can at least sway some opinions on their board.
I really like that comment, and I'm learning something tonight that I hadn't thought about. Could all of you carbon copy your state senator when you write the triplicate? And the team